Fatty foods, alcohol, lack of exercise, and stress. All things one low-country doctor says we can control. And if we do it right, we can ward off breast cancer. Deja Knight shows us a preventative method that can dramatically decrease our chances for a sickness that's diagnosed in more than 200,000 women every year.
You don't have control over your genetics, but there may be some things that all of us can do to help really dial down the likelihood of getting certain kinds of cancers.
Dr. Mickey Barber is part of Synergenics Medical Institute, a national age management medical practice that specializes in helping patients prevent cancer. New patients go through a series of blood work and testing to identify certain factors that may cause breast cancer.
They're going to be checking off things like life stressors that may be going on in the last year or two of their life, their medical history, their dietary history, exercise, and then we have them here for a whole day.
Barber's program is a combination of strict diet, exercise, meditation, and hormonal supplements tailored to every person.
So we're going to give them a plan, and we're going to be talking to them about every 6 to 8 weeks.
A new study in Europe shows the chances of breast cancer greatly increased in women who had more than 4 dramatic life stressors in the last year or two.
Things like divorce, things like death of a loved one, things like a disease in you or your children.
She says eating greens like broccoli and kale contain a compound that wards off breast cancer. Exercising 5 times a week and meditating 15 minutes every day can also dramatically reduce your chances. Also, cutting out happy hour could keep you out of the hospital.
Chronic consumption of over 2 glasses of alcohol a day dramatically increases your risk of breast cancer.
Barber says stem cells are being used more in the treatment of breast cancer. Doctors have the ability to store stem cells of a healthy woman, and if that woman is diagnosed later in life, doctors can use the stored stem cells in their treatment. Back to you.
All right, Deja, thank you. And while she does focus on preventative methods, she still encourages everyone to get mammograms and the checkup yearly by your doctor.